Hello, this is Michelle from Physioactive Indonesia, bringing to you our Singapore Surgeon Insight series. Today, joining us is Dr. Gurpal Singh, consultant orthopedic surgeon from Centre for Orthopedics, Singapore. How are you, doctor?
Hi, Michelle. I'm very well. Thank you.
Thank you for taking the time to be with us today.
Thank you so much for having me.
Doctor, can you tell us about your qualifications and specialties?
I am an orthopedic surgeon, sometimes also known as a mechanic and a carpenter. Reason for that is that we change hips and knees. So my specialty is hip and knee replacement. I do robotic-assisted hip and knee replacement surgeries. I'm also doing a fair bit of sports work, mainly related to the lower limb, hips and knees. And my passion is in orthopedic oncology, which is bone and soft tissue cancer. And I'm trained in complex reconstruction of the lower limb and upper limb with regards to um, limb salvage surgery, basically avoiding amputation and reconstructing the limb to restore good function in cases of bone and soft tissue cancer, which affect the bones and soft and muscles. Yeah.
So, our topic for today will be bone and joint pains and when to see a doctor. So, doctor, let's start by understanding what joint pains is along with its common causes.
So, bone and joint pain can roughly be broken down into, uh, you know, three categories or causes by age group. Generally speaking, in younger individuals, bone and joint pains tend to be related to some form of injury, usually sports injury, or related to workouts, sports. Once we are a little bit older, and now this is very sensitive, I would say, let's just say older than 45 to 50. Now that's middle age. Some form of wear and tear starts to happen in our body, and we tend to get wear and tear related issues. And if we have neglected injuries from the past, sometimes they can accelerate wear and tear.
Can you please
Great.
elaborate for our viewers?
As we look at the slides, so the first slide shows the structure of the knee. Um, what we need to understand is when we talk about arthritis, I think we focus our discussion mainly on arthritis as a cause of knee pain
Okay.
because it's the commonest cause that we see. And of course, there are other causes, sports injuries and all, but we can do that as topic for another day. So
Okay.
arthritis is wear and tear of the cartilage. Um, it's very important to understand that arthritis and osteoporosis are different entities. Um, I often see them mixed up, um, and I think this is a good moment to clarify this issue. Arthritis is wear and tear of the cartilage, which is basically the lining of the knee joint. If you look at the picture, it is the lining of the knee joint that wears out. Osteoporosis is essentially hollowing of the bone and does not give any symptoms until and unless the bone fractures. So again, this is topic for another day, but this is just to clarify that arthritis is wear and tear of the lining of of the joint, which is the cartilage, and it is not to be confused with osteoporosis. Now, symptoms of arthritis basically would be pain, swelling, stiffness, deformity. There will be good days, there will be bad days. There is one picture that I have on in the slides on progression of osteoarthritis. This is probably the most important slide in this presentation, where it shows the three pictures of the knee. On the left, we have a normal looking knee. So no one really comes to see us when the knee is completely normal. In the middle, we have early wear and tear depicted in that knee. And on the right, we have a picture where I like to say you need a tow truck when it comes to this point because, um, wear and tear has gotten to the point where It is very severe. Now, the unfortunate reality is, if I ask you to make a guess, um, what do you think is the percentage of people that come and see us when they are at the third stage?
Oh, I would think probably 80%
You're being
come
very
at the
nice.
third
Yes,
stage.
it's
Yes.
it's closer to, I would say, 90 or even 95%.
Oh, wow.
And
Okay.
and we've actually gone quite deep into why we think this is the case, because there it's a very common mindset to if you have a bit of joint pain, we say, okay, never mind, it's not life threatening. So the concept of, or the perception of joint pain not being life threatening is basically guiding the health seeking behavior of the person. Meaning, if it is a kidney problem or a heart problem, for example, it is very unlikely that you will sit on it and you won't see a doctor. But because it's a joint problem, often we say, okay, it's part of growing old, or we don't want to see a doctor, we don't want to see a physio, it's okay, we'll wait another day. But what we don't realize is that there are significant, it may not appear immediately, directly life threatening, but there are two ways in which it can potentially be life threatening. The first way is if the joint pain is due to something more serious, as we were talking about just now. About 10% of the time, the joint pain is not due to wear and tear. It is due to something else, like a cancer that has spread to the bone, to the hip, or the knee. So, even in this context, if there is pain at night, pain at rest, for example, that individual may be in that 10% that is actually, the pain is not due to only wear and tear, but something more serious, which means life threatening. The second way where joint pains can be indirectly life threatening is when someone has joint pain and that person also has other medical problems like heart problems, diabetes, for example. Because of joint pains, the mobility of that individual will reduce. The individual may have significant weight gain because of reduced mobility, and other conditions like diabetes, heart problems, blood pressure may worsen. And this increases cardiovascular risk. So, in other words, risk of stroke, risk of heart attack go up because that person is unable to exercise, that person is sort of having reduced mobility, and weight gain is there. All these things add up. So, it has been shown that, if mobility goes down, it does affect overall life expectancy, it affects cardiac risk. So, this is something that is often overlooked, and we dismiss it in our day to day life. Say, okay, joint pain, never mind, I'll seek help another day. But we will not do that if it is diabetes or heart or kidney. But the same joint pain can actually make the diabetes or heart or kidney problem worse because of lack of mobility, lack of exercise, weight gain. So, this is something that we need to understand. And we need to, if we want to take care of our overall health, then the bone and soft tissue, the joints, our skeleton, our muscles are an integral part of well being.
What kind of care and treatments are available? You had mentioned that surgery is not the first option. So, can we discuss the conservative
Yeah.
options?
When we have someone with joint pains, when we talk about conservative measures, we are discussing, first of all, what that person's lifestyle entails, what that person's needs are. Someone who needs to kneel for prayer, for example, and has knee pains will have a significant loss of quality of life if he or she is not able to do that. An avid yoga practitioner who's not able to sit cross-legged would feel very frustrated because he or she is not able to do so. So it's very important to understand where the person is coming from and what the needs of that individual are. And accordingly, then, we talk about physiotherapy. You're the expert in this, but physiotherapy also takes on a very targeted approach. If we talk about the knee, for example, what we like to do is we will map out the area. Let's say we do a clinical examination, we do an MRI scan. We can actually map out the wear and tear pattern in the knee. Sorry, yeah. So let's say we look at this, yeah. And if you do an MRI scan and you say the pattern of wear and tear is on the inside of the knee, and the person is already starting to have a little bit of varusness, i.e., the knee is loading in this direction, then what we can do is we can do our conservative treatment will involve, for example, offloader braces, where you're basically offloading the medial compartment and trying to put more weight on the lateral compartment. The physiotherapy regime will involve analyzing the person's gait, walking pattern, whether the person has any flat feet, how is the person loading, how can the person now walk in a way, strengthen certain muscle groups eccentrically so that the loading is more in a certain way. That's where a very close relationship and collaboration between physio and doctor come in. And the whole concept is individualized medicine. Same way when we talk about walking aids and reducing weight and all that, these are all tools that we have in our toolbox to sort of make that person, load the joint or the knee in a way that you are you're offloading the part that is worn out and you are loading the part that still can be used. Now, one of the other things that is gaining a lot of traction in conservative treatment is image guided injections. We almost all of us have an ultrasound in the clinic now, and we are able to do accurate sort of delivery of medicines and injections to exactly where the problem is. Regenerative treatments are gaining sort of popularity. Example would be platelet rich plasma injection, some forms of stem cell treatment, essentially trying to regenerate some cartilage where there is potential to regenerate cartilage. So, all of this, without getting too caught up in the technical details, the whole helicopter view of this or the whole conceptual view of this is customized or individualized medicine, where we are basically we are all, or I consider myself a tailor, and I'm making a dress for you in the way in the form of a treatment plan that is unique to you. And here's where, working with physio colleagues is very rewarding because we are able to come up with treatment strategies and plans in a way that is unique for that individual based on the wear and tear pattern that that individual has.
All right. And in the case of the surgery, what does a
Yes.
surgery entail and is there downtime? Are there different kinds of surgeries? Speaking of the
Yes. So
technology today.
if we just recall the picture that we had earlier where there were three knees in the picture, one
Mhm.
completely normal, one with early wear and tear, and one completely gone. So if we talk about the second one where there's early wear and tear, generally speaking, in that setting, we would, if there's a need for surgery, we would offer much smaller surgeries. I Most of the surgeries in this context would be arthroscopies or keyhole surgeries. Sometimes we would discuss partial joint replacements done in a robotic way so that we only replace the area that is worn out. If we are discussing surgeries for the grade 3 that we talked about, where the knee joint is completely worn out, then we will be discussing total joint replacements. And that is where most of the work nowadays is happening. Of course, we hope that by doing more talks of this nature, we are able to shift the pattern towards early presentation, early surgery, where much smaller procedures are needed. But to complete the discussion, where we are doing total joint replacements, again, we mostly do them with robotic assistance, using modern implants. And robotics is an exercise of accuracy. Now, I can give you an example here. If I just use a mobile phone, a lot of us have nowadays, we don't need to ask whether do you have a mobile phone? We straight away ask, what is your number, So if you look here, I've got this device. It's a mobile phone. And if I were to ask you what is 30 degrees, you might say this is 30 degrees. Somebody else might say this is 30 degrees. It's an estimation exercise. No human eye has the accuracy to say this is 30 degrees. Now, if I want 30 degrees this way and I want 20 degrees towards myself, for example, it's if you have 20 people in the room and you make them do this exercise, you will have 20 different combinations of that. Now, this is to illustrate to you that we do not have the vision to measure angles and degrees, you know. But if we are going in the direction of robotic assisted surgery, then what we are doing is we want to increase our precision. So, robotic assisted surgery is basically an exercise of precision. What it helps us to do is, again, in the line or in the concept of customized medicine, same concept again. We do a CT scan of the patient's knee. The CT scan is fed into the robotic software. We now have a plan of the knee. That means this person's knee and not a general plan of the knee. And we know how much we need to cut exactly to the millimeter, how much we need to trim the bone, what angle we need to restore. And we then execute that plan with a robot. Um, the surgery cut and everything remains the same, but the robot arm is then helping me to do the cut,
Mm-hmm.
executing the plan that we have made based on that person's knee. So that becomes a very individualized knee replacement, which is more precise. It is not relying on any estimates, but it is based on a CT scan of that patient, and the all the landmarks are based on that patient, and we are using technology to help us with the precision.
Okay, and what about downtime, doctor? So by this
Okay.
I mean, if first question is if patients from Indonesia plan to come to do a
Yeah.
surgery, what should the
Yeah.
itinerary look like? And
Okay.
secondly, what is the downtime of the surgeries?
Okay. So I will break this up into three common types of surgeries. The first one we talked about was the keyhole surgery.
Mm-hmm.
Now, keyhole surgery may mean cartilage repair, meniscus repair, ligament reconstruction. All this is usually keyhole. And if you're talking about keyhole surgery, generally speaking, the downtime is minimal. Uh, Depending on what we are doing, whether it's a meniscus or cartilage or ligament, the patient will have two small scars in front of the knee, two 1 cm scars in front of the knee, no big cuts, um, a period on crutches of usually about 2 weeks. And after 2 weeks, physiotherapy can start. At about 1 month, life is back to normal, back to the office. And of course, further strengthening exercises and all are ongoing. But the downtime in terms of period on crutches on average is about 2 weeks for most of these ligament, meniscus, cartilage reconstructions. For
Okay.
patients coming from Indonesia, a lot of patients like to sort of get the surgery done, and in about 2 days to 3 days, they actually go back because they often say that it's cheaper to travel back to Indonesia than to stay in Singapore for 2 weeks. And then they come back for a wound review at about 2 weeks. And then we can step up the further physio and all that. After that, we normally work with you guys,
Mm-hmm.
and what we do is we do the work after we do the wound review, we'll have a plan for you and say, okay, this is what needs to happen over the next 4 to 6 months. The next review is in about 6 months, and a lot of that can be even done over video consults. So the
Okay.
second type of surgery, which involves joint replacement surgery, um, partial joint replacement surgery, that means we're not replacing the full knee, but just part of the knee.
Mm-hmm.
That is about a 2 day hospital stay. Um, you After 2 days, the patient can actually go home, and usually about day three, they are walking after the surgery. They are fit to travel, and again, they usually come back and see us add about 2 weeks for a wound review, and we
Mhm.
step up the physiotherapy after that. The third type of surgery, which is a total knee replacement, which is a larger surgery, that usually the hospital stay is about 4 days. In this situation, we actually encourage patients to stay in Singapore for 2 weeks if possible, because we
Okay.
don't post-operative care in these settings is very important, and we don't really want people to be traveling on a plane to and fro, if possible,
Mm.
for the first 2 weeks. Again, the patient can walk after the surgery. So imagine if the surgery is done today, we'll walk the patient the next day. They normally need to be on a walking frame for about
Mm.
2 weeks, then a walking stick for another 2 weeks, and most people can walk independently at 1 month. The 2 weeks and the 1 month is a very good sort of average time frame to go by. For the larger operations, of course, we encourage you to stay in Singapore more than travel up and down. For the smaller ones, it's okay to sort of go back and then come back again.
Do you have anything else to add, doctor?
So, in terms of new technology, I think robotic assisted surgery is where we are heading. Um, there are a lot of misconceptions about knee joint replacement, where we are, what can we do, what we can't do after surgery. Again, it's very important that the doctor understands the patient. If we are, I'll just show you one of these. This is given to me by, I think it's not coming out so well. It's probably a mirror image. This gentleman is an
Mhm.
avid cyclist who's had two knee replacements, and he has done a 140-kilometer race after doing two knee
Wow.
replacements. So we're seeing a lot of these patients now, and this is not a one-off story. It is not that there are a lot of younger people with arthritis who still want to be very active. So the only two things we say you can't do after a knee replacement now are you can't do a complete squat. You won't be able to do a full squat, not encouraged. And we don't advise you to jump on the knee or run on the knee on hard ground. But like, a lot of activities like cycling, gym, cross trainers, going hiking, traveling, they're all possible. So it's not the end of the world if you need a knee replacement. Most importantly, it should be done in a customized way where the patient's needs are taken into account.
Okay, well, this is all great information, doctor. Thank you so much for your time.
Thank you. Thank you so much. Thank you.
For our viewers, if you are interested in speaking with Dr. Singh, you can find details of his WhatsApp, clinic phone number, and website in the description below. If you are planning to get your surgery in Singapore and live in Jakarta, you can start your physiotherapy at Physioactive Singapore and continue your rehabilitation program in Physioactive Indonesia. Please find details of our clinics below. On behalf of our entire team at Physioactive Indonesia, we want to thank you for tuning in, and we look forward to bringing you more top quality content from leading industry surgeons.